Hmtv viewers, it's an absolute pleasure having with us today the founder and chairman of Madhavbaug Hospitals. So let's talk in detail with them regarding diabetes and heart diseases. So are you ready? Sir, it's an absolute pleasure having you with us today.
Same here.
Yeah. So can you just give a glimpse of your journey and how has it been over the years?
Okay. The experience overall of this whole building of this organization for about 360 centers now with 4 hospitals, and all of this has been so in itself, it was so educational, and the things that have evolved out of it, so many doctors, so many medicines, so many patients, they have got the benefit out of it. I am super happy because of it. And this whole concept of Madhavbaug has evolved from my father's name, who was called as Dr. Madhav SANE. And as I lost him because of heart disease, there is where I started with this whole mission of having heart disease free India as a mission for all of our organization. So all of our doctors, all of our therapists, everybody works with a single mission of making India free from heart disease. So now when we talk about heart disease, obviously diabetes, blood pressure, obesity, cholesterol, all of these diseases come up. So when we start treating these heart disease patients, obviously all these risk factors are supposed to be taken care of. So as a whole of these 19 years, it has been a superb kind of journey, and I am still more excited about the next coming 50-100 years when all of these kind of young doctors join with us. The future is super for Ayurveda as well as for Madhavbaug.
That's a very impressive journey. So, but if I must say, there's always this myth surrounding Ayurveda and natural sciences regarding the modern medicine. So, do you think the penetration level of all these natural sciences like Ayurveda is as much as the modern medicine in India right now?
Yes, you are right in that case. See, to be very honest, I am a modern medicine practitioner. So I have done my MBBS, I have done my fellowship in cardiac from Apollo Hospital, and then I am into Ayurveda. So talking about both these sciences, I have dealt with both these sciences. I know everything about it. Now, when we talk about the awareness about Ayurveda as compared to allopathy, we have to take one thing into consideration, and that is about if we go back into the history before say about 200 to 50 years, there was no allopathy.
Yes.
Allopathy has come up only about 2 to 50 years back. Before that, if at all you talk about the history before that, everything was Ayurveda. For last 5,000 years, Ayurveda has prevailed as a science. Last 200 to 50 years since Britishers have come up and they wanted to give their revenue model to India so that they keep on surviving on our money over there, allopathy has come up. So, over here we need to understand is all those allopathic medicines that whatever we talk about have been inherited from Ayurveda itself.
True.
Like, for example, if at all we talk about the best acting cardiotonic drug from allopathy, which is called as digitalis, that is nothing else but foxglove plant, and that is Ritpatri from Ayurveda. If you talk about a mucolytic agent, which usually people have during cough, that mucolytic is nothing else but bromelain in allopathy, and that is nothing else but it's pineapple in Ayurveda. If you talk about statin, which is a multi-billion-dollar industry nowadays, that is nothing else but red rice fungus, which comes from Ayurveda. If you talk about the blood thinning agent, the antiplatelet medicine called as Ecosprin, which every patient usually beyond 40 years nowadays is consuming, those medicines also have come from Ayurvedic plants, that is Jalavetas. So all of these medicines from allopathy have a base from Ayurveda. So if we talk about the scientific authenticity of Ayurveda, it is absolutely proven, because 5,000 years, a science which has lived by itself, it did not need any kind of help from anybody. That science is absolutely Shaswat. Now, speaking about the awareness in nowadays for Ayurveda, as compared to allopathy, it has been a bit less, because last 250 years, English people have tried to drain Ayurveda from India, and they have condemned Ayurveda for no reasons. Now it is the time when people like us, which are coming ahead with good researches and proven evidences, which will show that Ayurveda therapies are far more better than any other therapies in the world. The glory, the lost glory of Ayurveda in some more years will be regained.
Yeah, true. So when we are speaking about diabetes in particular, like you said, in modern medicine, it's about using the same medicine or with changes for like, a long time. So, but you're claiming that, it can be reversed.
Yes.
So what's your take on it?
Absolutely, yes. Diabetes type 2 can be completely reversed. There have been several such case studies. Every month we have about 1,500 to 2,000 patients whom we perform a test called a GTT, that is called a glucose tolerance test. As you must be knowing, a diabetic patient should not have sugar.
True.
That is what everybody knows. Now, post-treatment of Ayurveda by Madhavbaug, post-treatment, these patients come back to a good control of sugar in their body to such an extent that in this GTT test, we give them 75 grams of glucose to consume, and post that 2 hours, the blood sugar has been assessed. Still you see the blood sugar going to be normal. That is, the system inside has rectified to such an extent that the blood sugar has come back to normal. Now, the question is, how does this happen? This is very much unbelievable. Now, this is not at all unbelievable because this is a pure science. Normally, what happens is, in diabetes, there are majorly, we need to understand 3 compartments inside the body to understand the reversal. The first compartment is the gut, through which we put the food inside and the sugar is usually produced in over here. That is the first thing, is gut. The second thing is, most important, is your blood vessel. The sugar which you have consumed enters into the blood column, and from the blood column the sugar has to enter into its final destination, which is called as a muscle, where the sugar is utilized as energy. Now, in diabetes, all these 3 compartments are not healthy. But in a healthy person, when they are healthy, the transport of the sugar till the muscle goes on very easily. In diabetes, what happens is, from gut to the blood vessel, the transport is easy, there is no problem. But from the blood vessel to the muscles, the transport required GLUT4 receptors on the muscle membrane. These GLUT4 receptors were blocked in a diabetic type 2 individual, due to which the blood sugar could not travel from the blood column into the muscle and could not be utilized. Now, to reverse diabetes, what we got to do is, these GLUT4 receptors which are present on the muscle membrane, we are just supposed to remove the fat plaque which has gone inside the GLUT4 receptors, and they have blocked the GLUT4 receptors. If at all, by some other way, if at all we remove this fat plaque from the GLUT4 receptors, the things will reduce down, the blood sugar will enter into the muscle membrane and it would get utilized as energy. Now, the question comes in, how would we remove these fat plaques inside these GLUT4 receptors? Now, research says, last say about 50-70 years of research in this whole field, it says that 1 gram of fat, if at all it reduces from the pancreas, the GLUT4 receptors would get clear. So, for all the GLUT4 receptors to get clear, 1 gram of fat should reduce from pancreas, and to reduce on 1 gram from the pancreas, 1 gram of fat from the pancreas, we will have to reduce 10% of your body weight. So, if at all a 70 kg person comes in with type 2 diabetes, we will have to work accordingly, in which we will have to reduce down his 7 to 10 kgs of his weight, due to which he will lose that 1 gram of fat on his pancreas, due to which the GLUT4 receptors will be renewed. And if that happens, then blood sugar would be utilized into the muscles as energy, and the patient will no more be a diabetic. So that's a pure science. Now, to reduce down this weight, there are several ways. One is, the most important thing is diet. Now, in South India, where we see maximum amount of rice is consumed, and if at all you talk about the glycemic index of rice, as you must be knowing, the more amount of carbohydrate we consume, more amount of fat is going to get produced, which is going to block these GLUT4 receptors. So to reduce down fat, we will have to reduce down the carbohydrate intake. Now when we talk about carbohydrate, in whole of India, when we see usually the breads that we usually have, roti hai, chapati hai, whatever, if at all we understand the grains and the glycemic index, it's very simple. If at all you have wheat, which usually most of our Indians have, that wheat usually has in 100 gram of wheat, there is about 90 to 95 grams of sugar. If at all you talk about rice, rice has about 80 to 75 grams of sugar in 100 grams of rice. If at all you talk about chickpea protein, that has only 23 grams of sugar in 100 grams of chickpea. While you talk of barley, it has only about 15 to 20 grams of sugar in this grains of barley. So, on the basis of this, what these patients are supposed to be fed is what Madhavbaug has researched for. So we have created typical diet kits, and diet kits is nothing else but a 6 to 7 kg wala box in which there is subah ka nashta, the meals in the afternoon, the evening breakfast, the dinner, the tea, as well as the breakfast. Everything is available in this whole diet kit. The patient doesn't have to go hunting for anything. He just has to take that diet kit, follow it for next 2 to 3 months, rest, leave it to us. So it is so simple to reverse diabetes in next 2 to 3 months only. The diabetes disease which was created by this individual in last 15-20 years, to reverse it, it would take maximum about 2 to 3 months. So just follow the diet kit and the problem disappears.
Will dissolve. So I must say, sir, really that over years, what I know about diabetes is very less compared to what I've learned in these few minutes. So wonderfully explained. So, sir, now talking about like the heart diseases, we have seen especially in youth, even the statistics say that a lot of, depression, anxiety, panic attacks, all these are increasing, which is leading to stroke and heart diseases. So what's your take on it?
Absolutely. You are absolutely right. For heart disease, the first reason for leading to heart disease is stress. Ayurveda 5000 years ago mentions in a simple shloka, Chintyanam ati chintanat iti rasavahini dushyanti. That means your blood vessels would get damaged if at all you stress out a lot. Stress and sleep, they are directly proportional. If at all your stress increases, the sleep reduces. So this inverse relationship between stress and sleep can give you a very good idea. Many people, when we ask them in our clinics that are you stressed, they say no. But when we ask them about sleep, they say it's damaged. It's completely out of question that they don't sleep at all. So this is what every individual has to understand. Research also says so. If at all you have 6 to 8 hours of good sleep every night, heart disease is going to be away from you, because the stress hormones which are supposed to be in control, the adrenaline, noradrenaline named hormones which are supposed to be in control, they are usually controlled by melatonin named hormone, which is a sleep hormone. So if melatonin increases, stress hormone reduces down as well. Being happy in life produces serotonin named hormone. So if serotonin increases, stress will reduce down. But many people don't understand this as well. There is a relationship in between carbohydrate intake, the rice intake that we usually have, the excess amount of consumption of these grains that we have, the carbohydrate ingestion, whenever it increases the stress hormones. So many a times, if at all patients come to us and say that I want to reduce down my stress, the easiest answer is reduce down the carbohydrate. Now reducing down the carbohydrate could be two ways. One is have complex carbohydrates. Complex carbohydrates means what? Like for example, in South India, we have many people or most of those people consuming rice. Rice, when it is polished, it becomes a simple carbohydrate that will increase the stress hormone, that will increase the diabetes risk, that will increase the heart disease risk. But the same rice, if at all we can have a non-polished rice with the husk on it itself, which will take a longer amount of time to boil and cook. But this rice is going to be superb if anybody wants to reverse their disease. So having stress in control is absolutely easy, because whatever stress you are going through, it is not what is happening to you, but stress is all about how you respond to things. So problems will be all over the world every moment. Problems are not going to disappear. What is going to improve is your reaction against the problem. So you need to control your reaction, for which you need to control your stress hormones. And for controlling stress hormones, you will have to control your carbohydrates, and for carbohydrates, you will have to control your diet. So reversing heart disease is also possible. There are several patients who come to us with huge amount of blockages in their coronary arteries. People who have undergone angioplasty, people who have undergone bypass surgery, not only once but twice or thrice also, these people also come down to us later on because cardiological problems, heart disease problems are usually recurring every time for those patients, and the reason for that is stress, and second is diet. And the third thing what is important for heart disease reversal is good exercising lifestyle. So reversing blockages with all these Ayurvedic lifestyle changes, whatever have been mentioned, is surely possible. We have several research papers which have been published which say that heart failure also can be reversed, as well as blockages in the coronary arteries also can be reversed, and we have published several case studies as well as several research papers which show that angiographically documented blockages also can be reduced down with 3 to months of efforts of lifestyle modification. So, in 3 to 4 months of efforts, if at all a patient can reverse their blockages, if the person continues those lifestyle changes for long life, he would never end up into problem, and that is how India will become disease free. So, heart disease reversal, if it's possible, surely yes, it is completely possible.
So, sir, does Ayurveda even help with chronic heart diseases?
100%. What happens is, usually if at all we see, heart disease is the acute heart disease is usually for those 6 hours episode only. Right now in this room, nobody has had heart attack, but heart attack, if we understand, it is only a 6-hour episode. If at all a patient starts with that heart attack, 6 hours the blood clot which has formed inside, which has clogged the blood vessel, this blood clot will stay alive only for 6 hours. At the end of 6 hours, either the blood clot will be demolished or else the person will disappear. So some other thing would happen, but that is a game of 6 hours, and leaving that, everything is chronic cardiac disorder. So acute disorder is only for 6 hours, while rest of his whole life is chronic heart disorder, because what happens is, once the patient suffers a heart attack, he is always a heart patient. Now, this heart patient has to be dealt very strategically, wherein the reversal of this heart disease has to happen. So, in those 6 hours, when the acute episode ends, rest of the life the patient is in chronic disorder. So, when you ask about chronic disorder reversal of heart disease, absolutely yes. Acute disorders where the patient has already suffered or in the phase of those 6 hours of heart attack, Madhavbaug has no role in over there as of now. But leaving that and rest of the life, Madhavbaug will help the patient to improve the quality as well as the quantity of life. Now, to reverse the chronic heart disorder is not so difficult. Usually there are few typical things, like one is a patient who has suffered a heart attack due to which the pumping power has reduced down. To improve the pumping power, Madhavbaug has different treatment protocols which we usually implement and improve the ejection fraction of those patients. At the same way, there are several patients post angioplasty. There are residual blockages which were not being addressed during the angioplasty due to several reasons. There is where Madhavbaug plays a role and reverses those blockages also. There are several patients who have been diagnosed with blockages on the angiography and don't want to undergo angioplasty. There is where Madhavbaug does a major role in reversing their blockages. There are several patients post bypass surgery also, where still the patient again comes up with the same symptoms and the patient doesn't want to again go under the knife. There is where Madhavbaug comes into action and helps the patient. So there are several such use cases where patients have come to us with different scenarios, and Madhavbaug has helped more than 10 lakh patients till today to reverse their heart diseases, diabetes and blood pressure.
That's really impressive. So, getting to know that this is possible even without surgery is really a great thing, which needs to be,
Absolutely.
penetrating even the tier 2 and tier 3 cities,
Very
because,
true.
like you said, not everybody is comfortable going under the knife.
Very true. And most of, if at all, there was a survey done by Ayush government itself, that how many people would like to undergo Ayurveda and how many people are already going under Ayurveda therapy. 82% of Indians are already having some or the other form of Ayurveda treatment. So that could be of various different types. But on an average, if at all you ask anybody, before undergoing an operative intervention, people will always try to undergo some kind of Ayurvedic intervention which is non-invasive. That is safer, that is faster, that is more reliable, and that is free from adverse effects. So it's always a good option.
Sir, as you said, I think India going down that path is really commendable.
Very true.
So, sir, we have spoken about diabetes and heart diseases. So, they also say that cancer is one of the leading causes of deaths, and it's increasingly growing in India.
True.
So, are you working in that angle also?
We have been working on cancer as well as renal disorders. There are several researches that we have been going through. In the next, say, about 12 to 24 months, we'll be coming up with those kind of therapies also, which will help as a palliative therapy in cancer, but again a reversal kind of thing in chronic renal failure. So kidney disorders are increasing like anything. So kidney disorders need that kind of reversal. In cancer, whatever researches that we have done till now, they are majorly about the palliative kind of things, in which the patients would continue their allopathic management, unlike cardiology and diabetes, where we usually insist there is no need of having any kind of concomitant therapies with Ayurveda, because this is enough to reverse your diseases. In case of cancer, the researches that we have done till now, it is majorly a palliative kind of therapy and not a complete reversal kind of therapy. But the researches that we are right now doing for renal failure, over there I am quite confident next 12 to 24 months we should be coming up with a renal failure reversal kind of therapy.
That's very good to know. So, because like we see many people, even youngsters, are suffering with kidney related diseases.
Absolutely, that is very, very painful nowadays, and because of kidney failure, the youth is also under a lot of disease burden, as well as because of this renal failure, there are several other parameters that the whole family, because of all this, suffers. Every second week or every second day the patient is supposed to go for dialysis. There is where Madhavbaug will like to work in the future. If at all we could reduce down the number of dialysis, the frequency of dialysis, and the total dialysis, if at all we can shut down that towards zero, then Madhavbaug would win. That is what I usually consider.
Beautiful. So, what are the expansion plans? I mean, where are you currently situated and what are the expansion plans?
So, right now we are about 360 clinics all over the nation. We are there in Maharashtra, Madhya Pradesh, Uttar Pradesh, Gujarat, Goa, Karnataka, Delhi, Chhattisgarh, Hyderabad, Telangana. So we are now trying to establish our footprint all over the nation. So in the future, we will be planning to expand towards about 1,000 clinics all over the nation. As well, we have 4 hospitals. So as of now, we have about 110 beds with us, but in the next 12 months, we will be expanding ourselves towards about 350 beds, and in the coming 3 to 4 years, we will be planning to go for about 1,000 to 2,000 beds, so that all those acute cases also, along with subacute cases, can be treated in the hospital, and the chronic cases can be treated in the clinics. Usually it has been said that a diabetic patient or a heart patient usually likes to get treated in his community place at his home itself. So our clinics, the Madhavbaug clinics, are usually located at such a place where the residential area is located. The patient doesn't have to travel so far, because at the end of the day, this is a lifestyle management kind of treatment, in which in the lifestyle management, the doctor has to have a very good friendship with the patient, because every now and then there would be certain kind of questions coming in the patient's mind, and they are supposed to be addressed by a doctor. So the best doctor-patient relationship available all over the nation should be there in Madhavbaug.
Understood. So, sir, we are looking forward for these clinics in the Telugu states as well, because that would serve a very large community, and also people are looking forward towards moving towards Ayurveda. So That's a good thing.
Absolutely. So I do promise that in next say about 12 to 24 months, we should be having more than 100 clinics in the Telugu states itself.
That's really good to know, sir. So this has been a very enlightening session. Thank you so much for being with Hmtv.
Thank you very much.
Thank you, sir.